So anatomy, we are studying the structure of the human body. So this anatomy, we divide it into three. We have what is called gross anatomy, embryology, then histology. So can you all hear me? Can you all hear me? Yes, I think you can. Right. So we are saying that we have gross anatomy, histology, and what? And embryology. So gross anatomy, you're talking about the macroscopic structures, which includes your appendages, that's your hands, your feet, your heart, the structure. Then we talk about histology. Now it's the microscopic structure and function. That is your cells, how your cells are made up of, how your cells unite to form structures such as your organ system, right? And embryology, now we're talking about the development of the human body, right? How your limbs develop, how your brain develops, and the likes. So today's topic is on anatomical terminology that we use, because before you start to talk about fascia, about ligaments, about aponeurosis, we should first of all understand the anatomical terms which we use when we are talking as physicians and as medical practitioners, right? So we should understand and appreciate the fact that whenever we are talking about terms in anatomy, we talk about them as relating to a standard. So the standard in which we talk is called the anatomical position. So in this position, a person is standing erect, facing forward. The upper limbs, these are the upper limbs or the hands, projected by the sides, the palms facing forward, and the lower limbs together. The soles of the feet are on the ground and the toes are pointed forward. All these directions and movements described are based on the anatomical position. So there are 4 geometric planes, 3 of which are at right angles to each other and are applied to the body in the anatomical position. So when we are studying anatomy, we use this as the what? As the reference points. The arms or the upper limbs to the sides, feet together. You are not on your toes, but your feet are flat on the ground. Your face is projected towards anteriorly, or let's say forward, body forward. Your palms are faced forward, right? So from this anatomical position, right, there are planes of section, right, in which we can view our internal organs, in which we can view your visceral organs, your bladder, your kidneys, your heart, your lungs. So we can do a plane section on the middle of your body, which you call the median plane, right? Or we can do a plane which is called a horizontal plane, in which we can see the upward view and the downward view, or a superior view or inferior view of your body, right? So the median plane now is a vertical plane passing through the center of the body, dividing it into equal right and left half. So it's only called a median plane if it goes on the middle of the body, right? Dividing it into equal left, equal right, right? Then we have what is called the sagittal plane. So this is any line which is parallel to this median plane. For example, this line which is cutting through the clavicle, the patella, and the foot, right? We call this one a sagittal plane. It's just parallel to the what? To the median plane. Okay, very important. Then we have what is called the coronal or frontal plane. This is also a vertical plane which is now situated at right angles to the what? To the median plane. As you can see, this is the coronal plane. So this coronal plane divides the body into an anterior and posterior portion, right? An anterior and posterior portion. We also have what is called the horizontal plane. It also lies at right angles to both the median and coronal plane. So the horizontal plane divides the body into upper and lower parts. We also have what is called the transverse plane, but sometimes this transverse plane is interchangeably used with horizontal plane, but these terms are not the same. You can look at the leg. We can say that this is the transverse plane of the leg, but this also is the transverse plane. Why is that so? So transverse plane, it is used whenever we can roughly say that the transverse plane lies perpendicular to the long axis. So whenever we have a long axis of a structure, the plane which lies perpendicular to it is the transverse plane. Unlike the horizontal plane, which is always at right angles with the coronal and the median plane. I hope it's clear. So another anatomical term which we can use is anterior or ventral, right? So anterior describes something which is in the front. We don't use front and back in anatomy. We use anterior or ventral, dorsal or posterior. So if you have something which is anterior or in the front, we call it anterior. For example, your nose is anterior to your eyes, right? And your eyes are posterior to your nose. We can also say that your nose is ventral to your eyes and your eyes are dorsal to your nose. I hope that makes sense. But we also have a kind of unique way of describing our hands. The anterior surface of your hand, we don't call it ventral, we call it the palmar aspect. That's why you say, go touch your palm. That's where you find your fingerprints. That's where you find these creases of lines. You find it on the what? On the palmar aspect. I hope that's clear. And the dorsal aspect, we call it the dorsal aspect of the hand, right? Then on the foot, we also have a unique way of talking about the foot. Where we find the fingerprints of the foot, we call it the plantar surface, in which you plant your foot on the ground. Then the dorsal surface is where we find your hair, your nails. This is called the dorsal surface. So the plantar surface is on the ground, your dorsal surface is on the superior surface of the foot. Those are anatomical terms we use. We also use the term medial, right? So if a structure is situated nearer to the median plane, right, we call that structure to be medial. For example, your what is this? Your eyes are medial to the median plane because your eyes are nearer to the what? To the median plane. Unlike your ears we call them lateral because they are away to the what? To the median plane. So we say that your eyes are medial to the median plane as compared to your ears, which are lateral to the median plane. I hope that's clear. So medial refers to a segment which is nearer to the median plane, unlike lateral, which refers to a structure which is away from the median plane, right? For example, your eyes are lateral to the nose, right? Your eyes are lateral to the nose. We also use the term superior and inferior. Superior denoting structures which are high up, nearer to the head, right? We also call it cranial or cephalic. Cranial meaning the cranium, the cranium. So any structure which is above or near to the head, we call it superior, and any structure which is near to the feet or to the foot, we call it inferior, right? These are the anatomical terms which we use. We do not use the term up or down. We say superior orocranial, superior orocephalic, but cephalic means brain. So that's why we say anything that is superior, it's cephalic. Anything that's superior is also called what? Cranial. Then inferior denotes anything that is below. For example, your feet are inferior or caudal. Making sense? Then we also use the term proximal and distal, right? So let's say, for example, we are using our reference point as the trunk, your trunk, right? We say that your shoulders are proximal to the trunk, right? They are nearer to the attachment to the trunk as compared to your hands, which are distal to the trunk. Again, we say that the joint which is connecting your hand to your arm, your forearm, we say that this joint is distal to the trunk as compared to the joint which is connecting your arm to your forearm, which is called the elbow joint. The elbow joint is near to the trunk as compared to the what? To the wrist joint. So we say that the elbow joint is proximal to the trunk while the wrist joint is distal to the trunk. So these are the anatomical terms which we what? Which we use, right? Another anatomical term is superficial and deep. So superficial denotes positions which are which are like superior to a given structure. For example, we say that the skin is superficial to your ribs. Say that. All right. So now we're talking about superficial and deep. Right. These are the terms which we use in anatomy. So superficial is any structure which is closer to the surface, whereas deep is any structure which is away from the what? From the surface. For example, we say that your skin is superficial to the ribs. They're in direct contact with the what? The ribs anteriorly. While the heart is deep to the ribs. Your heart is found within the rib cage, while your skin is found superior to the what? To the rib cage. Another anatomical term which we use is internal and external, right? So internal is any structure which is inside, right? And external is any structure which is outside. For example, you know that your rib cage, yeah? Right? Inside the rib cage, right, we have the thoracic cavity, and outside or external to the rib cage, we have the what? The skin. Another anatomical term which we use is ipsilateral and contralateral. Ipsilateral meaning on the same side. Ipsilateral means on the same side. For example, we can say that your fingers and your right fingers and your right palm are on the same side. So we say that they are ipsilateral. And if you want to say your right arm and your left arm, we say that these are what? Contralateral. Your right arm and your left arm are contralateral, while your right fingers and your right hand are on the same side. They are called ipsilateral, right? Then another anatomical term which we use is supine and prone. Supine, it means your body is lying on the back, right? Your body is lying on the back, your face facing upwards. While prone means you are lying downwards, your chest directed to the floor, right? That's prone position. Let me see if I have it's not clear here, but just know that when you're in a supine position, your head is projected to the floor, your back is on the floor, your feet are projected upwards, your hands are projected upwards. While a prone position now is like you are sleeping now, your chest is projected to the floor, your face is on the floor, your hands are on the what? Floor. That's the prone position. Now we have another term, I think some of you are familiar with it, which says afferent and efferent, right? So afferent means we are now going to the point of reference. For example, we have afferent nerves. Afferent nerves, they are going back to the what? To the brain. While efferent nerves are going away from the nerves. Another example, venous blood is afferent, is going back to the heart, while arterial blood is going away from the heart. So these are the anatomical terms which we use. Then we have terms which are related to movement. We have terms which are related to movement. These are the terms, right? Let's explain them. We have flexion, right? Flexion is the movement in which a joint angle is decreased during motion occurring in a sagittal plane. So that sagittal plane is any line which is parallel to the median plane. So this is flexion. Flexion is this movement. We are reducing the angle between your limb and your shoulder. We are reducing the shoulder joint. This is called what? Flexion of the what? The shoulder joint. While extension of the shoulder joint, we are increasing the angle on the what? Shoulder joint. So as a practice, extend your hand in an anatomical position and move your hand forward. You are flexing the shoulder joint. If you move your hand backwards, you are extending the shoulder joint, right? Another example here, flexing the elbow joint, extending the elbow joint. Flexing the elbow joint, we are reducing the joint angle, right? And extending the elbow joint, we are increasing the joint angle. Then here it's kind of contradicting with what you may be thinking, but here when you're talking to your lower limbs, things are reversed, right? So your knee joint, whenever you are flexing your knee joint, you are going backwards, right? But whenever you're extending your knee joint, you're going forward, because this is the angle which we are talking about, right? So whenever we are flexing, we are reducing this angle. Whenever we're extending, we are increasing the what? This angle. Okay. Then we have another special feature of movement which happens on your feet. Movement called dorsiflexion and plantar flexion. So plantar flexion is like you are moving. Let's say all your feet are firmly on the ground. Then you do a tiptoe position. That is called plantar flexion, right? Tiptoe position, plantar flexion. Then a position in which you reduce the angle here, right? This angle on your foot is called dorsiflexion. Like you're moving your foot upwards. Moving your foot upwards is called dorsiflexion. Moving your foot downwards is called plantar flexion. Planting your feet down forcefully is plantar flexion. Moving your foot upwards is called dorsiflexion. Right. Then we have another anatomical position called abduction and adduction. Abduction, you're moving, it's a movement away from the midline in the coronal plane. Let me show you abduction. Here, this is the coronal plane, right? Forward and backward separate. So we're saying that moving away from the midline is called abduction. Abduction, for example, you're being abducted by an alien, you move away. Then adduction, you are coming back, you are adding to the weight of your body. Adduction. Then abduction, away from the body, being abducted. Or if you understand Shona, we are saying abuda, abduction. Adzoka, adduction. Right? Abuda, adduction. Abduction, sorry. Adzoka, adduction. Right? Then we move. Invasion and evasion. These are special kind of movements which are done by what? By your feet. All right? For example, can you see that this is invasion? Invasion. The sole of your foot is going inwards. Invasion. Right? The sole of your foot is going what? Inwards. Invasion. Then evasion. The sole of your foot is going what? Outwards. Evasion. Alright, I hope that's clear. Then we have rotation, right? We have medial rotation and lateral rotation. So in medial rotation, right, it's the movement that results in the anterior surface of a part facing medially, right? And lateral rotation is a movement that results in the anterior surface of a part facing laterally. Let's see this one. Okay, this one, medial rotation. The anterior surface is now facing what? Medially. The anterior surface of your arm is now facing what? Medially. You have medially rotated the shoulder. You have medially rotated the shoulder, right? You are rotating the shoulder medially. The angle, it's like we are moving. The ball and socket here is being projected inwards. Then here you are laterally rotating the shoulder. You are putting your hand away from the midline. Laterally, you are laterally rotating the shoulder joint. Hope that one is clear. Then we have a very cool movement called circumduction. So circumduction, it involves all of your movements, right? It involves abduction, adduction, flexion, extension, and rotation. For example, if you stick out your hand, right, to the side, then you start forming like a circle. Let me just. Then you start forming like a circle. You form like a circle, like you are spinning. Let me show you the person who's doing that movement. Yeah, like you are circumducting. You're forming a circle. You're circling. That's the movement we call circumduction. It's not rotation. It's called circumduction. Okay. Then we move. We have a special movement which is done by your hands, right? It's done by the joint which is here. We call it the radioulnar joint, the proximal radioulnar joint, in which your hands, they move into a supine position. Your forearm, moves into a supine position, right? Like you move like you're saying, can I have some soup? Can I have some soup? Can I have some soup? Supine. Then prone, you are moving like away from that supine position. You are kind of retracting your hands, right? This is supine, the pour soup. Can I have some soup? Pronation, you are now kind of protracting your hands. flipping your hands back, right? In which like the the dorsum of the hand is faced anteriorly. I hope that makes sense. Then protraction and retraction. So this protraction and retraction, you can do it on your like your back muscles here, like you're protracting, you're moving anteriorly, protracting, then retracting outwards, protracting inwards, right? You're moving forward, retracting outwards, protracting inwards, retracting outwards, right? Even your jaw, you can protract, move it anteriorly, or retract, move it posteriorly. Yeah. So then there's another issue here which you call eponyms. Is it eponyms? In which in anatomy you can like back then people who discovered let's say a certain structure, they used to name it after their names. For example, foramen of Winslow, it was discovered by the guy called Winslow. For example, these units called volts, ampere, and stuff. But in anatomy, we are trying to remove this nomenclature, in which we want to directly link a structure to its function, not necessarily the name of a person. So modern biomedical sciences are trying to remove using these the names of people and trying to use more scientific names, right? So that was then also there are very important functions of the thumb, which you can extend your thumb, you can flex it, extend, flex it, extend, flex it, or you can abduct the arms. If you are abducting the arms, you're moving them away from the midline. Adducting, you're moving them back to the midline. Then this very nice movement in which it's called opposition of the thumb, in which you're trying to join your index finger to your thumb, right? Called opposition of the thumb. Then we have this position. We call this movement abduction of the trunk. This is your trunk, right? We are moving away from the midline, so we're abducting the the trunk. This is called abduction of the of the trunk, right? So these are your anatomical positions, movements in a nutshell, right? So this is the first lesson you will learn when you're talking about gross anatomy. So the next lesson we will talk about what is called gross anatomy of the upper limb, right? Because in anatomy, as biomedical scientists, we do what is called regional anatomy, in which we study anatomy by regions. We don't study anatomy by systems as other faculties, right? We study it by region. So next time we're going to talk about anatomy of the gross anatomy of the upper limb. Let me just show you the gross anatomy of the upper limb. This one. This is the next one which we are going to talk about. We're going to talk about osteology, right? Then next time we'll talk about the regions, the pectoral region, muscles, nerves, and the likes. So that was it. I don't know if there are people who have any forms of questions. Any questions? Any questions? Yes, Stacy, you can ask.
So can we access your PDF or your presentation?